antibiotics in animal shelters. And first I just wanted to talk about with a real world scenario. Okay, so this is our scenario. So we are an open admission municipal shelter. The shelter is totally indoor, which probably doesn't help. Put a couple hundred dogs together in a room where they can cough and sneeze all over each other, and it's difficult to control respiratory diseases. Cats are housed individually, but most dogs are in kennels with 3 to 8 dogs per kennel, depending on the size of the dogs. And our executive director wants me to put everyone in the shelter on antibiotics in order to prevent them from becoming sick, and that's several hundred animals. So this was an email that went out. So this is the veterinarian in a shelter sending out this email. And when I saw it, coming from public health, I freaked out a little bit. So what I want you guys to do as you read through it or listen to that, what gets you thinking? What are some of the things that you're having an issue with in this email, or get you thinking about some red flags or why they may be having these disease issues in their shelter? So it sounds crowded, right? Okay. Fresh air, so yeah, they're indoors, so we may be thinking about that. Okay, we don't know if they have isolation, right, but they may not. Certainly, yeah, always got to be thinking about facility design. I'm sorry? Stress, yep. Okay. Anything else? Antibiotics as a preventative. Thank you, yes. So, when I read through this, so these were some of the red flags I got out. So they're an open admission municipal shelter, which isn't, I'm not saying that as a red flag that that's a bad thing, but I'm just saying, okay, this makes me think that they're going to have to take everything that comes through their door. Shelter is totally indoors. Somebody pointed that out. Okay, so it gets you starting to think about what their airflow HVAC is like. A couple hundred dogs together in a room. Sweet Jiminy. Now you're starting to think about capacity and that they're probably overcrowded, especially when you're seeing that they're putting 3 to 8 dogs together in a kennel. We don't recommend that. Difficult to control respiratory diseases. Well, you think? Yeah, I could have told you that before even going to your shelter. The executive director wants me to put every animal in the shelter on antibiotics. So now I'm assuming that this shelter director is not a veterinarian or trained in veterinary medicine, so it makes me think that a lay person or an untrained person is making some antibiotic recommendations or medical recommendations. And then the director wanted him to put every animal in the shelter on antibiotics in order to prevent them from becoming infected. So it's not even treating infection, we're thinking about prophylactic use right now. And that's, again, several hundred animals. So sweet Jiminy capacity. And unfortunately, that's kind of the nature of the beast with animal sheltering to a certain extent, that we're really set up for this perfect storm of disease. We have a rapid turnover of animals in our facilities in general, and it's a large number of animals that are coming through, and a lot of them can be really high risk to the shelter. So we may have neonates coming in, we may have sick animals coming in, or we may have wildlife coming in that's sick. And they're co-mingling in the sense maybe, you don't have the raccoon and the puppy and the kitten hanging out in the same run together, but you may have the same staff handling each of those animals. So they're co-mingling in that sense. And this just provides a great opportunity for co-infections and maybe some crazy infections, co-infections that you didn't think about that are going to exacerbate your typically normal animal shelter diseases, and they may really confound your diagnostics. So you may not actually get back information that you're looking for because you don't even know what to test for. A lot of times we have poor facility design, as I'm sure you can all attest to. You may be in an old shelter that was designed maybe just for dog control, just your dog warden, and now you're housing these other animals. Or maybe it was retrofitted, and you kind of retrofitted as you needed. So maybe you added on a room when you started taking in more animals or doing cats or something like that, but it wasn't retrofitted in a grand scheme, an overall design flow. So now you just have these little pockets of rooms that are adding up to your facility. Often you have, again, untrained personnel making medical decisions just because you don't have access to a veterinarian or a veterinarian trained in shelter medicine or veterinary technicians. So you're trying to do the best that you can. Everyone has limited resources. If you don't, let me know because I may be looking for a job in July. And that's certainly going to involve your staff, finances, and your ability to do diagnostics. And also your facilities can be a limited resource. And then image and public relation concerns can be a huge issue for shelters. I mean, you can just go on to some shelters' Facebook pages, and you can tell right away that there's a concern in the community with image. And a lot of times, I think shelters do things out of fear of public backlash, and it may not be the best decision for that population, but there's more concern about fear of what the public perception is going to be. So you're just set up for a lot of issues. So today, in the time that I have, I'm going to just touch on the challenges of identifying life-saving opportunities for antibiotic use in shelters, the possible risks associated with antibiotic use in the shelter environment, guidelines for the judicious and appropriate use of antibiotics in shelters, and then some sample protocols. We may not be able to get through all the protocols, but they're in there. Again, they're samples. It's not set in stone that you have to use those protocols or anything like that, but just some ideas to think about. So if we don't get to them all, they're there for your reference, and I'm happy to talk to you about them after. So we're going to need to use antibiotics in shelters. We just know that. But we have to do it in a wise way, and we also have to think about the challenges that we're going to face when we use antibiotics in the shelter. So our number one challenge is treatment failure. And when we have treatment failure, we're going to have wasted animal care days and resources. So we spent resources on an animal, kept that animal in the shelter or in our foster home, and it didn't get better. And this is going to increase the staff stress as well as the animal stress because the animals are not getting better. And that's really stressful. You're there to take care of animals. You don't want to see them sick. You don't want to see them not getting better. It's very stressful for both parties, and a lot of times can lead to animal suffering. If the animals aren't getting better, they're not being treated appropriately, then they're suffering. Often we worry about the inappropriate utilization of antibiotics in shelters. So we may be using the wrong antibiotic because we weren't able to do a culture of sensitivity, or we don't even know maybe what pathogen we're dealing with because we haven't been able to do any diagnostics. So we're just kind of hitting them with what we think might work or what we think it is. Or a lot of times we may be treating a viral disease because, again, we might not have had diagnostics, or untrained staff are making decisions and maybe they aren't thinking about that this could just be a viral disease, but we're going to hit it with antibiotics. And they seem to respond. Well, maybe they're just responding on their own because it was just the natural course of time, not necessarily the antibiotic, but you may not know the difference, and it seems to be working. And then no matter how great any antibiotic is, if you fail to address the compounding factors of disease in your facility, you're never going to prevent upper respiratory infections from happening. So you really need to address that stress to control the herpes infections in the cats. You need to address the husbandry, and that, to me, oftentimes is capacity. You can't have hundreds, thousands of animals in your facility and expect to not have disease. And biosecurity is huge. So you want to make sure that you're not being a fomite, that you're not spreading disease to these animals, and that you're cleaning properly. We also need to be aware of the side effects that some of these antibiotics may have, and your staff needs to be aware of these side effects too, or the shelter staff. So a lot of times you may see vomiting or diarrhea or anorexia because of an antibiotic. They need to know that, they need to look for that, and they need to communicate that to you. So something doesn't happen where this animal may be then euthanized because now it has a secondary condition. Okay, it started with an upper respiratory, we'll go ahead and treat that. But now we put it on something, and now it has diarrhea. Well, now this cat maybe has 2 strikes against it, and maybe it's more likely to be euthanized, but maybe we did that to the cat because we put it on a certain antibiotic. So they need to be aware of that and thinking about that. You might see some neurologic changes with certain antibiotics, so the staff needs to know that so they can bring it to your attention. You may see toxic changes, so you kind of have to do a risk-benefit about what antibiotic you're going to put them on, and are you going to taste the risk of maybe some toxic changes by using that antibiotic. And then allergic reactions. We need to be prepared for those. Are you able to treat an allergic reaction in your facility if it happens? And does staff know what they look like, how to alert you if there is a reaction, or what to do? And that includes ophthalmic antibiotics as well. So, you know, your innocent terramycin may not always be so innocent. And of course, we're always concerned about resistance. Resistance is a huge issue with antibiotic use, and very much in the public scene. So it's very important that we choose antibiotics wisely and think about the repercussions that they may have. It has been shown that animals treated with certain antibiotics, especially like Baytril or cephalexin, are more likely to be shedding resistant bacterial pathogens like E. coli. So it's really important to consider as a veterinarian and as a shelter because you're sending these animals home to be with their people, and if their people are anything like me, then there's probably 4 dogs at any given time sleeping in their bed. So there's these very intimate relationships with our pets that really put humans at great risk of getting exposed to potentially resistant bacteria. So antibiotic resistance is certainly not a new topic for any of us, but I think it's worth taking the time talking about 2 cases of antibiotic-resistant salmonella in animal shelters. So the first case was in Minnesota, and what happened was the actual shelter sent in some samples on some of their cats that were having diarrhea, and these samples went to the Department of Ag, which then sent it to the health department for typing. And when it got to the health department realized, hey, this matches, all these cats' types of bacteria match each other, and then 4 humans came back also with the same type of salmonella. And this salmonella, Typhimurium DT104, is often multi-drug resistant to things like ampicillin, tetracyclines, chloramphenicol, so it's resistant to a lot of antibiotics. So they noticed that, big red flag goes up. In the end, after their investigation was done, 7 human cases were identified. 6 of the 7 people had a connection to Shelter A. 4 of them had adopted kittens, and 2 attended the same daycare as one of the adopters. They could never figure out the connection to the last person. There were 9 different cats that were identified. So all these cats had come from different sources, yet their common link was that they were housed in Shelter A. And 6 of those 9 cats had been adopted, and 5 of those 6 had been returned to Shelter A for illness. But not all of these cats actually had diarrhea, so some of them were asymptomatic. So we can't, again, just go on clinical signs to know that disease is present. So in the end, the shelter had to have enhanced infection control procedures and environmental sampling to make sure that they had cleaned the environment properly. One of the humans that was sick shed salmonella for like 200 plus days, and then one of the kittens that was positive also shed, and I don't even think this one had clinical signs for over 100 days. So it hangs around for a long time and can be a risk for a while. In another shelter, this was in Iowa, the health department brought this to their attention. They hadn't submitted any samples of their own, but 6 people were identified with this multi-drug resistant salmonella, and the common link that they could find based on their extensive questionnaires that they usually send out when you have some sort of potentially foodborne outbreak like this, was the common link was cats adopted from the shelter. In the end, there were 49 human cases identified and 10 people were hospitalized. Fortunately, no one died, but you would almost expect someone to because it typically has a 3% mortality in people. So they were very lucky in that sense. And the shelter felt that there was a high correlation between animals on antibiotics and the salmonella in their shelter. They never figured out what the source was. It could have been humans bringing the salmonella in. Maybe they were sick with it and exposed the cats. It's not always the cat's fault. They had a bunch of cats that came in from a hoarding case, so maybe they were more high risk in shedding it, but not all the cats from the hoarding case were shedding it. Food, certainly. Typically, this is a foodborne disease, so maybe some sort of contaminated food came into the facility. And again, the cats weren't always sick with diarrhea. Some of them were healthy looking. So their response, they had a huge public relations response. They released a press release. They sent out bulletins to all their veterinarians, and they made a phone call to each adopter to let them know what was going on. The adopters were very upset, more upset that something bad was going to happen to their cat, so they didn't want to talk to anybody until they knew that their pet wasn't going to be euthanized. And then the shelter, because they had salmonella like everywhere, they had to close for 3 weeks and gut their whole cat facility. They had to get rid of all their cages because they were like these laminate cages that were scratched up, and they couldn't properly sanitize them to get rid of it. And they had some interesting points that they made after about lessons learned and practices changed. And the director said, we've really changed the way we handle sick cats. In some ways, I think having the veterinary staff contributed to the problem, so maybe we're not always so good. But we felt that we could treat a lot of animals that were ill in the shelter because they had that staff and those resources. But in hindsight, maybe that wasn't the best plan. So now they have a 0 tolerance for sick animals in the shelter. Any sick animals are moved to isolation and have to be out in foster within 24 hours. And they have a more judicious use of antibiotics, so they're not just kind of putting everybody on antibiotics. They also made 1 cage per cat per stay, so they got rid of their laminate cages and went back to stainless steel cages, which maybe aren't so pretty, but are easier to clean. And now they're all on wheels, so they move around with the cat. So as the cat moves from intake to adoption to surgery, it stays in its cage. Because changing cages can cause up to 80% of cats to start shedding pathogens again from that stress alone. So now the cat stays in its house. Its house just kind of moves with it. They have escorts that escort the public through the facility now to make sure that they are washing their hands and or wearing gloves. And they have no get acquainted areas now. So no one can say for sure that the antibiotic resistant strains that were found in those shelters were because of those shelters using antibiotics. But I wanted to just present those cases to remind you that we really need to be antibiotic watchdogs and use antibiotics judiciously in the shelter environment. And one of the best ways to reduce your need for antibiotics in the shelter is to utilize preventive strategies. So preventive strategies include appropriate husbandry, and that means that you want to stay within your capacity for care. You don't want to overcrowd your shelter. Hygiene, that you want to actually be cleaning your shelter properly and with the appropriate disinfectant for the pathogens that you typically have in your facility. So if you have parvo or panleuk, then you don't want to be using a quat. Routine health monitoring. You want to be doing daily rounds, like was discussed this morning, to take a look at every animal. And you want to be giving immunizations, so your modified live vaccines at or before intake. So those things should be emphasized to reduce your need for antibiotic use. And I just have in this picture this poor guy that's calling out here. So he was here all donned in his PPE in isolation, but he doesn't quite have the shoe covers on all the way. So they're on the tips of his toes, so we'll give him, some credit for effort. But he has the gloves and his little gown, but then we just kind of lose it right there. So I'll show you over here. So he just has them there. And then we watched him walk out of isolation. Hey, I need some more litter boxes. Oh, let me wear my PPE in this common storage area and get litter boxes to bring back to isolation. So things like that, just catching those things and making your staff aware that they're not doing this can really reduce your risk of disease in your facility. So I know it was talked about this morning with daily rounds, but it's really critical that your daily rounds team goes through and looks at every animal on a daily basis, and you want to look at them, visually assess them for health, and then look at overall review their movement through the facility. What do they need to be done to get out of there? So principle number 2, you want to look at other therapeutic options to consider prior to antimicrobial use. So maybe you want to house high-risk animals off-site. Get those neonates out of the shelter. Get those sick animals out of the shelter so they're not exposing your other animals to disease. Separate animals by species. That's great for stress control. You don't want your dogs with your cats. They kind of freak out about it. And maybe you don't want your reptiles hanging out with your cats, because reptiles, salmonella. That's all I'm saying. So probably not the best idea to co-house and co-mingle like that. So you may not even want to house reptiles on site at all, or you certainly should have them in a different area, and you may want to think about different staff. So you want to modify housing to be species appropriate. So if you have those double-sided runs for dogs with guillotine door, make sure you're using them right. There shouldn't be a dog on each side with the door down. Cats, you want to make sure they have a place to hide. That'll really reduce their stress. Ideally, they should have a big cage with 2 sides, but at least give them a box or a towel to hide behind. Alter the environment. Make sure it's quiet and comfortable. Barking dogs, very stressful for you, as well as the animals in your care. Make sure it's warm enough for those neonates that they don't have to spend all their energy trying to stay warm, and they can use that energy to stay healthy. And then provide enrichment on a daily basis. So that shouldn't be an afterthought in our shelters. Enrichment really needs to be a key part of how we take care of the animals in our care. So utilize culture and sensitivity, or PCR, to help aid in your selection of antimicrobials when relevant. So I can't stress testing enough. I know often resources are the limiting factor here, but sometimes it's worth spending that money up front to do some tests to figure out what you have, and then you'll save money on the back end because you're treating appropriately or making appropriate decisions. So you should monitor what's in your facility over time. Then you can also test if you're faced with unusual presentations. What's going on? Why is this kennel cough so weird? Oh, because maybe it's distemper. And then you also want to look and test if you have an increase in disease rate to figure out what's going on and maybe what has changed or what's come into your facility. So again, antimicrobials should be used when you have appropriate indications. You want to treat when animals are sick, not prophylactically. And you don't want to use it when you have uncomplicated viral or pathogen or parasitic infections, which can be hard to know for sure if you're not doing testing. So that can certainly be a challenge. And then you want to minimize environmental contamination. So you want to dispose of unused medication in the garbage, not down the toilet. So this is also part of our role of being an antibiotic watchdog. It's not just prescribing medications, but also how we dispose of them. And then feces should be disposed in the trash, not flushed down the drain, because a lot of times antibiotics are going to be eliminated through the GI tract and go into those feces. So we want people to pick up feces anyway because we don't want them hosing down and aerosolizing for other pathogens, but now this just adds to my fight for feces to get picked up and not washed down the drain is also because of potential antibiotic resistance. So we'll go through some sample antibiotic protocols. So protocols, I think, are a great way for shelter vets to establish their intentions or communicate their intentions to the rest of the shelter staff when they want to put animals on antibiotics and why. So their protocols provide a systematic approach for the veterinarian and their staff. They provide consistency, so everybody's on the same page doing the same thing. So I know when I went in to volunteer in shelters as a veterinarian, but before I knew really anything about shelter medicine, I probably did more harm than good because I came in with that private practice mentality. But if I had protocols to follow by someone who knew what they were doing, I would have been able to follow their protocols and we all would have been on the same page and animals would have gotten consistent care and staff wouldn't be trying to rip their hair out because everybody does something differently. Your protocols should be practical, clinically effective, and cost effective. Now all those things are going to be dependent on your organization and your facility. So it depends on the pathogens that are present in your facility, which you may learn about by doing testing. What is the mission of your facility or organization? What is your goal? And then what are your resources? Do you have money to spend on testing, on prescribing antibiotics and treatment? And do you have skilled staff that you can trust to give the medications and give them properly? So we'll just go through a few of these protocols. I created them from some of my own research and stole them as well from others. And I'm not saying, again, that these are set in stone or something you have to do. It's just kind of an idea of how you could set up a protocol. So if you're presented with a cat that has clear ocular or nasal discharge and sneezing, I would say you'd want to monitor its appetite and hydration, make sure it's eating and drinking, and do that daily. You want to minimize stress, certainly, because it's probably herpes in the short-term shelter. Your vet should be involved in looking at that animal maybe every 1 to 3 days to see what's going on. You may want to think about isolating that animal at that point in time in foster care. And if you can't change the environment to reduce the stress for that cat, and you know once your animals start presenting with clinical signs that they just go full bore, then you probably want to start antibiotics at that time. And an initial antibiotic that we would recommend would be doxycycline. And you'd probably want to do that for about 7 to 14 days if they're responding. And based on Dr. Litzter's poster back there, she would recommend 14 days. 14 days or more. And you want to treat towards clinical signs improving and not just a timeline. If you're seeing colored ocular or nasal discharge, then you're going to do the same as above. You may want to add nasal drops, which can be saline, or sometimes people are using some antibiotics in the nose as well. And again, start antibiotics if you hadn't started them earlier, and again, the doxycycline. So here's just a sample daily monitoring sheet. This one is really about behavior and what the animal's doing. But it's good to have on hand. You can certainly modify it because it's important to monitor their response to treatment to see if they're improving and eating. There's another one that, again, also looks at their behavior, if they're eating and drinking and improving. But then it also has what their treatment is, and the person can initial that they've given it. So there's some accountability there and responsibility. So continuing on the sample upper respiratory protocol for cats, if they're responding to doxy but maybe still symptomatic and not improving as much as you'd like, then I would continue the doxycycline and add an additional antibiotic. You may want to think about using Baytril, Clavamox, or an azithromycin, and there's just doses there. And again, you want to be reassessing these animals. I can't stress that enough, to make sure that they're improving. You're not treating just for a week because that's what was written. You want to make sure that they're improving and responding. So if they're on the doxy but they're not responding to it, then I would stop the doxycycline and think about one of those other antibiotic options, such as Baytril, Clavamox, or azithromycin, because there are some of your secondary pathogens that are often gram-negative bacteria that can be involved with these cats with upper respiratory infections, and that's what we're trying to target here. If the animal recurs their upper respiratory signs after stopping doxycycline, then you may have Chlamydophila, so you probably want to test and see if that's what you have, but you may also want to continue doxycycline then for about 4 to 6 weeks if they responded and they respond again to it. If we're dealing with just kind of eye issues where they're getting their goopy eyes, you want to certainly monitor appetite and hydration status. Again, minimize stress. Can't stress that enough with cats, and have your vet engaged looking at the animal. Think about doing some antibiotic eye ointment, but I think one of the most important things is to have them on a systemic antibiotic as well during that time. And doxycycline will penetrate their tears, so it's a good antibiotic to use, as well as Baytril will too. And then if you're seeing these persistent ocular discharge, maybe some more intense eye changes such as edema, ulceration, again, you may want to think about doing testing at that time to see for sure what's going on, and you may want to start thinking about some antivirals in the eyes as well as orally. So some famciclovir can help a lot. And I know I'm running out of time, but I do think it's important to get to this one, and also you'll tell me when I'm absolutely out of time, right? I have 1 minute. Okay, great. So we talk about using doxycycline a lot in shelters, but what's the best way to do it? And everybody kind of has their own secret recipe. We hear about Val syrup a lot, which is off the market now, so what's everybody going to use? Molasses, fish oil. And when I talk to pharmacists about this, they're like, Sweet Mary, don't do that. And then I'm like, well, what do I do? And they're like, buy Vibramycin. And I'm like, but that's really expensive and the cats don't like it. And they're like, too bad, buy Vibramycin. And so there was an abstract in 2011 at ACVIM this year, and it talks about compounding doxy. They use the tablets, which actually the pharmacist told me don't ever use tablets to compound because they're not stable, and don't split them. But they used the tablets here, and they crushed it with a 50-50 mixture of Aura Sweet and Aura Plus. And when they looked at it, it maintained its potency for 7 days. So, and it stayed within its 90 to 110% potency. And that was in light or dark conditions, and it wasn't in a fridge. But when you went out longer than 7 days, it wasn't useful. So if you're compounding, you want to be careful, certainly with what you're compounding with, and these aqueous and water solutions seem relatively stable for compounding, but you don't want to have a product on the shelf for a long period of time. And I'm out of time, sorry. So, but I do have, there's some more upper respiratory protocols for dogs, and then we go into a little bit about diarrhea. So I apologize for running out of time on you. So dogs are relatively similar. We're going to put them on doxycycline as well. You want to monitor their appetite and hydration status. Isolate them because they're going to be more of a risk to the other dogs themselves because of coughing. Restrict their exercise. You probably want to test them for heartworm. You may want to think about a cough suppressant. If doxy's not working, you may want to switch to Clavamox or Baytril. I know Laura's going to talk a little bit about diarrhea, so there's a few protocols in there about it. And so in summary, it's far more effective to prevent or minimize exposure to infectious agents as a means of preventing infectious disease. You want to optimize each animal's immune status to minimize the effect of infections without use of antibiotics. And you want to monitor the well-being of your animals in your facility and evaluate overall well-being, changes in health, and response to treatment. And you need to document that in a permanent record. And you want to treat either to cure or failure rather than just time. Here's some references for you. My favorite picture ever. And just want to thank Maddie's, and I'm sorry for running out of time on you guys, but I'm here to answer any questions that you have. And if you need it in a bigger format, because I know it's a little small, those slides, just let me know, and we're happy to get that to you. Thank you.